الله الرحمن الرحيم. نرحب بكم في الجلسة الأولى من اليوم الثاني لهذا المؤتمر
Welcome,
المتميز
ladies and gentlemen,
والذي
to this
سنواصل الحديث
distinguished
فيه عن موضوع
conference,
في غاية الأهمية
the
وهو
8th
استجابة
Annual
الدول
Gulf Studies Forum. We
لجائحة
shall be
فيروس
talking about
كورونا
the response
والتي بلا
of
شك
the
كان
Gulf
لها
states to
تداعيات كبيرة
COVID-19,
على
which
مختلف القطاعات
had
سواء
huge
قطاعات التعليم أو
implications
قطاعات
on
الصحة أو قطاعات
education, health,
الاستثمار.
investment,
كذلك لها تداعيات كبيرة
and other
على
sectors.
الحكومات
It
وعلى
has
الشركات
also
وعلى الأسر
impacted
والمجتمعات.
the
وفي
society,
الحقيقة يعني
the
المؤشرات
families,
واضحة بأن هذه
and the
الجائحة حقيقة
indicators
أحدثت
are
يعني
clear.
ربكة
The
كبيرة
pandemic has
وانحسار كبير سواء
confused
في الأنشطة
people
الاقتصادية
and has led to
منذ الثلاثينات.
disturbances
تشير الأرقام إلى أنه أكثر من
in the
200
economy.
مليون إصابة
200 million
وأكثر من يعني
people
أكثر من
have been
5 ملايين
infected
حالة
and
وفيات.
more than 5
وكذلك قيل
million
إنه
dead.
يعني هناك الكثير من
Indeed,
فقدوا وظائفهم جراء هذه الجائحة.
a
وكظاهرة
good
استجابة
number of
الدول
people have lost
بين
their
من
jobs.
تقدم
The
يعني حزم
response
الإنقاذ
has been
للشركات وللأعمال وبين
different.
من قام بتطوير البنية الأساسية خاصة فيما يتعلق بالتحول
Especially
الرقمي.
as far as the digital
اليوم صراحة
transformation
نركز
is
حديثنا
concerned.
عن
Today we will be
سلطنة عمان.
talking about the Sultanate of Oman.
لدينا متحدثين
We have two
دكتور
speakers,
أشرف مشرف
Dr. Ashraf
والأخ
Mushrif
مبارك
and
الحمداني.
Brother Mubarak
سيكون لكل
al-Hamdani.
متحدث 20 دقيقة يسلط الضوء
20
فيها على
minutes will
الأوضاع
be
الجارحة
allotted
في
for
عمان
each speaker.
وكيف استجابت
They will
السياسات
be shedding light on
وكيف كانت
the
تداعيات
Sultanate
هذه
of Oman and its
الجائحة سواء
response to the
على الاقتصاد
COVID-19
العماني
pandemic
أو
and
على
its
الحكومة
implications on
العمانية
the
وعلى
economy of
الشركات
Oman,
وأهم
the
السياسات
government,
التي تم
the
يعني
corporate sector,
الاستفادة منها للحد من
and
الآثار السلبية لهذه
the measures
الجائحة.
taken to curb
نبدأ
the impact
بالمتحدث
of the
الأول الدكتور أشرف مشرف. هو
COVID-19
قامة اقتصادية
pandemic.
ورئيس
Mr.
تنسيق
Ashraf
غرفة
Mishrif
تجارة صناعة
is a
عمان في جامعة
research
السلطان
chair
قابوس.
for economic
كذلك
studies
درس
at the
الدكتور
Oman
أشرف في
Chamber of
جامعة
Commerce and
كينغز
Industry,
كوليدج
Sultan
وله
Qaboos University,
العديد من
Oman.
الكتب
Previously,
والنشرات
associate
والمساهمات
professor
العلمية
at King's College
المفيدة.
London,
أترك
and he
المجال
has
الآن
published many
لمدة 20
books.
دقيقة
20 minutes
للدكتور
for
أشرف.
Dr.
تفضل.
Ashraf Mishrif. Please, the floor is yours.
شكرا دكتور يوسف. السلام
Thank you,
عليكم.
Dr. Yusuf. A very good
من أهم
morning to
التحديات
you.
التي تواجه
One of the
المجتمع
most
العماني
important challenges
الحالية
Oman
هي
faces
التي تعرض لها على مدى
is
عامين
the
من
implications
كوفيد-19.
emanating from
وجدنا أن
COVID-19
تأثير
during the last
الجائحة على
2
الرغم من أنه تأثير
years.
عالمي أثر على
The
المجتمع
pandemic
الدولي
has
بأكمله في كافة
impacted
نواحي الحياة،
the international community,
إلا
has
أن دول
impacted
الخليج
our
كان
globe.
التأثير
However,
كان تأثير
the Gulf
الجائحة مضاعف عن هذه
countries
للغاية
has been impacted
لعدة أسباب. أولا
in
طبيعة الاقتصاد الخليجي
in a
وطبيعة
greater kind of
الاقتصاد العماني
fashion
بيعتمد على
because
النفط
of different
والغاز،
reasons. As you know,
وكان من
Oman
أهم التحديات
relies on fossil fuel,
والصعوبات اللي
and
استخدمتها
one of the most
كوفيد-19 هو
important challenges of the pandemic
اضطر
has
الدول
been
إلى غلق الحدود
related to
وغلق
closing the
حدودها
borders
أمام حركة التجارة العالمية،
before the
غلق
international
المصانع، غلق
trade, shutting down
المؤسسات
plants
الإنتاجية،
and the
وبالتالي
production
أثر بشكل
institutions,
كبير على
and thus
الطلب
this
على
has
موارد
affected
النفط
the
العالمية.
demand
وبالتالي
on oil.
تأثير الجائحة على سلطنة عمان كان
So the
بسبب
effect
انخفاض
of
الشحن
the
الطلب على
pandemic on Oman has been intrinsically
أثر على
related to the
مكانة
low
السلطنة
demand
المالية
on
في
oil, and this
المجتمع
has
الدولي.
negatively
التأثير
affected the
الثاني
status of the
كان
Sultanate of
بسبب
Oman
الصحي والمؤسسي
in the international
وبسبب
community
سياسة الإغلاق التي اتبعتها
and
السلطنة خلال العامين
the lack
الماضيين،
of
وبالتالي
the
أثر على
levers.
كل النواحي الاقتصادية وخصوصا
The pandemic has affected all sectors, especially the economy and namely the production sector.
على سلطنة عمان
As far as the impact of the
أثر عليها من
pandemic is
عدة
concerned,
جوانب.
Indeed, the impact
الجانب
has
الصحي
been
والجانب
multifaceted.
البشري
It has affected the health sector, the economy, the society. On the 24th of February 2020, since the start of the pandemic, the outbreak has been fierce, very swift, and the Sultanate of Oman took preventive measures, stringent preventive measures that have led to partial closure and complete closure later on of the plants, the governmental institutions, and the private sector. And this has affected the line of production. The Sultanate has also resorted to stringent measures as far as the tourist sector is concerned, the transport, the industry, as well as the trade institutions, the commercial institutions. So the impact has been fierce. The budget has inched closer towards deficit, and that's why the Sultanate of Oman has resorted to the international community to plug the gap of the deficit. The deficit has amounted to 18% of the budget, and the public debt has been $1.5 billion or 1.5 Omani Riyal in 2014 to 17 billion Omani Riyal in 2020, and this indicator has been a dangerous one because this has been unprecedented in the economy of the Sultanate of Oman. Following this introduction, we wanted to assess the measures taken by the government of Oman, and indeed the government has taken a number of measures that conform to the public health policy, as well as the monetary and the fiscal policies, in addition to providing subsidies and incentives to the institutions and the corporates to press ahead with their work during the pandemic. So, assessing the fiscal, monetary, and the other policy has led us to the diagnosis. The health economics has been our focus in order to understand the impact of the infectious diseases on the societies by and large, especially when it comes to the socio-economic domain. We have had a number of cases. We've looked at the Spanish flu and the SARS and the H1N1 and also a number of other cases internationally. The paper addresses a number of measures taken by the government, internationally speaking, to stave off the pandemic and deals with the measures taken by the Sultanate of Oman.
في جانب تطبيقي احنا بنتخذه في
As far as
الدراسة بيعتمد
the
بشكل رئيسي على المنهج التحليلي
practicalities are
لإعادة
concerned,
تشغيل
we
الظاهرة ثم
resorted to the
بنتخذ
quantitative analysis of the
بنقوم
phenomenon,
بإجراء عدد
and
من
then we
المسوحات والمقابلات
resort to certain
الشخصية مع
surveys and
الشركات
interviews with
وبالتالي
those who work
في
at the
خلال الدراسة
corporate level.
جمعنا
We,
ما
in
يزيد
accordance with this
عن
study, we
واحد
had
عملنا مساحات مع
accumulated
61 شركة
a
في
number of surveys. We have
السلطنة
conducted interviews with
وعدد من
61
المقابلات بيزيد عن حوالي
companies,
30
in addition to
مقابلة مع
30 individual
الكبيرين
interviews with the
المسؤولين
CEOs,
في
as
السلطنة.
well as
بنتبع
other
البرامج
employees. The SPSS program for the quantitative analysis and BIBO for the qualitative analysis have been focused upon. And if we look at the upshot of the study, we find out that the Sultanate of Oman has been impacted negatively as far as the fiscal policy is concerned, and the most important outcome was as follows. The monetary related governing policy has been a sound one in order to rationalize the expenditure as well as the resources as far as the budget is concerned, and this has led to belt tightening and curbing the deficit of the budget, and this has led to further measures, the like of having incentives and subsidies to the business by and large, and the Sultanate of Oman has taken a number of steps, namely the encouragement of the FDIs, the foreign direct investments, as well as providing incentives for the local corporate sector as well as the multinational companies. More than 8 billion Omani riyals have been funneled into the market in order to provide the necessary liquidity for the companies working locally in Oman. So all these measures have helped greatly to mitigate or curb the expenditure and reduce the deficit of the budget. If we have a look at the outcomes of these interventions during the last year and a half, the credit rating of Oman has been negative in the last year. However, it is now stable, and this is quite an achievement. The Standard & Poor's and Moody has improved the credit rating of the Sultanate last month, and it has become stable, and this is emblematic to the fact that the fiscal policy has been successful. Further on, the provision of incentives, as we said, has constituted a great step, especially as far as business is concerned, and following the survey that we have conducted, it transpired that a number of measures that have been taken place, especially as far as the reduction of the fees paid to have license and so on and so forth, and in addition to other measures, the like of postponing the payment of taxes and the municipality fees to 6 months, and this has been renewed for another 6 months. I mean, the postponement and the exemption of the corporate sector of some municipal related fees, and also deferring some of the payments, and all such measures have helped the corporate sector, especially the SMEs, to weather the storm to a certain extent. As regards the outcome of the survey, we have found that most of the major companies have not been impacted greatly with the implications of the pandemic. Most of the impact has been felt by the SMEs. Indeed, the SMEs have faced credit crunch and lack of liquidity. So the main problem that they have faced has been related to access to finance. This was the main dilemma that they have faced. The other issue is the lack of demand on their produce. Most of the companies have suffered from the lack of demand because, as you know, the lockdown has affected greatly the trade, the movement, and the demand consequently has plummeted, and this has been a negative aspect of the pandemic. The workers or the laborers have been affected as well. Most of the SMEs that have been compelled to shut down their businesses, obviously they laid off their employees, and this has led to great sufferings. Some workers, rather than being laid off, have agreed to a lesser salary, a deduction in their allowances and salaries. So, in addition to that, the pandemic's implications on the labor market has been negative. More than 500,000 migrant workers were compelled to leave the Sultanate of Oman during 1.5 years of the pandemic, and hence the impact of the pandemic has been great, and this has led to disturbances in the economy, in the tourist sector, the service sector, and other sectors as well, because of the drain of such number of workers. In addition to that, the Omanis have been affected as well, because the local workers have been affected to a certain extent, but to a lesser extent in comparison with the migrant workers, because of the protection measures that that the government has taken. A decision has been taken to stop terminating any contract for any Omani, and thus the companies have paid the salaries to the Omanis, even if they were not working. The Sultanate also has established the Social Security Fund, or and the
الذي يفقد وظيفته
those who have
يأخذ مساعدة من
lost their
الدولة من
jobs,
خلال هذه
they
الصندوق
resorted to
وبالتالي
such
كان
allowance
التأثير
from this fund,
محدود على
and
المواطن
hence
العماني.
the Omanis have been
نجحت سياسة
affected to a
التأمين
certain
الطبي إلى حد
extent,
كبير بالعكس
but
طورت
not
الدولة
greatly.
هذه
The
السياسة
government has
إنها
developed
تغطي أو توسع
the
مظلة التأمين
insurance
الاجتماعي
policies,
أو
the
التأمين
social
الوظيفي
security
بالنسبة للعمالة
policies,
المحلية
and
وإلى حد
in addition to that,
هناك شبه استقرار في سوق العمل في
in the
السلطنة.
labor market in the Sultan of Oman, we have witnessed lately kind of somewhat stable indicators. In addition to that, the percentage of the unemployment rates, it's been 1.8% in 2019. It has become 5% in 2020 or 2021, and this is a huge jump. And this is emblematic to the fact that the Sultan of Oman has been affected indeed negatively because of the pandemic. The Sultanate has failed to fill the gap of those who have left it. 500,000 migrant workers, as I said, have left the Sultanate, and thus this vacuum has not been filled. And I think the reason has been related to the lack of the low-skilled migrants by and large. I have touched upon the sectorial distribution of the pandemic and its impact on different sectors in accordance with the study. There were certain discrepancies in the data, the official data that has been provided by some companies, and the data that we have compiled from our sources. In the industrial domain, we have noticed that most of the major companies registered in the Muscat stock market have gained a huge margin. Most of the companies that worked in the industrial sector, the medium-sized and the SMEs, have not gained huge margins, but rather they have registered certain losses. So it was to do with the ability of the major companies to stave off the pandemic in comparison with the SMEs. The SMEs funding capabilities or is meager, and that's why they cannot confront such a huge pandemic. In the logistic domain, despite the partial and the full closure, this sector has benefited greatly from the pandemic. Most of the corporates that have worked in this sector reported high profit, but still they have encountered some obstacles, the lack of stores due to the health-related measures and preventive measures that have taken place during that period. And but mostly these companies in the logistic domain were very glad for the increase of the demand on their services. As you know, the tourist industry has been affected negatively. 70% of the income of the tourist sector has disappeared, and indeed it has been affected greatly in comparison with other sectors. There is also a difficulty for this sector to recover uh, because of the different variants that have been surfacing all the way through. So there is no possibility for this sector to recover unless the pandemic is gone once and for all. The SME sector,
كان أكثر القطاعات وخصوصا في مجال الريتيل، مجال تجارة التجزئة كانت
the SME sector,
هو
especially
القطاع
in
الأكثر
the
في الخسائر،
retail
ولكن
domain,
الإجراءات التحفيزية
have
كمان
incurred
لم
great
تستطع
losses,
أن تساعد
and the
هذا القطاع.
incentives
معظم الإجراءات
were not able to
التحفيز الاقتصادي
improve the performance of
ولدت الآن
this sector. In the
الفئات الصغيرة
Sultanate of Oman, it
والمتوسطة
transpired that the SMEs were not
التحفيزات
able
التي قدمتها
to
الحكومة
benefit from these incentives of the government for different reasons.
معدل التحفيز
The
الاقتصادي الآن أو المساعدة
economic
اللي كانت متاحة
incentives
كانت لا تزيد عن
rate
3000 ريال عماني، وده بالنسبة
amounted to
للشركات
3,000
مبلغ صغير لا
Omani
يستفيد
riyals, and
منه
this is
بشكل
uh,
أكبر في
a very meager
الإجراءات
sum
اليومية
that
لها،
cannot
خصوصا
help
في
in
إجراءات وفي
carrying out the
مرتبات.
daily activities of the SMEs, especially when salaries
لما نيجي
ought to be paid and so on and so forth.
الدراسة ما زالت
The
دور
study
التطوير، ونحن
is
في المراحل الأخيرة
not complete yet, and we are
لانتهاء
finalizing
البيانات
the analysis of the
الموجودة
data available
والمرتبة.
to us,
ولكن
and
بالنسبة لخلاصة هذه الدراسة،
the
معظم
despite
السياسات
that,
التي قدمتها
most
الحكومة
of the
سواء
policies that the Sultanate of Oman's government has
سياسة الصحة العامة
put into
وخصوصا
place,
سياسة
especially the public health policy
الإجراءات
and
الاحترازية
the preventive measures, as well as the vaccination rollout, have had a positive impact to curb the death toll. The percentage of the recovery in the Sultanate is higher than the median rate globally, so we can say that this policy has helped the Sultanate to overcome the pandemic as far as the fiscal and the monetary policies, as well as the funding related sustainable plans. Indeed, they were successful in curbing the negative impact of the pandemic. The Sultanate has improved financially, and as we said, the credit rating has improved, and the rates of investments are somewhat good. So we can say that the Sultanate of Oman is delving into the first chapter of the recovery. Thank you for your listening, and that was it. Thank you.
ورقة متميزة دكتور أشرف.
Thank you very much indeed.
من المهم الإشارة إلى أنه تعرض عمان لجائحة كورونا تزامن مع عدد من العوامل. عمان فقدت
Oman has lost Sultan Qaboos, the builder of modern Oman, lately, and the transition of power has been smooth. His Majesty Haytham has continued the journey. Most of these factors have affected the response of the Sultanate of Oman vis-à-vis the pandemic. In summary, indeed, the pandemic has directly affected the supply chains locally and internationally, and this has led to the lack of demand on the produce and the commodities because of the lockdown, and also impacted the most important element in the Gulf, i.e. the oil prices, and this has disturbed the budgets. The Sultanate of Oman has followed austerity measures, and as you know, the governmental expenditure is the locomotive of of any economy in the Gulf. This has affected consequently the corporate sector to create jobs, and people were laid off and so on and so forth. In accordance with the doctor's paper, there were economic, monetary, and fiscal policies, and these policies were positive to attract FDIs. The question is, has the Sultanate been successful? I think this answer is premature. The pandemic is still going on, and what's concerning is that the uncertainty is still there, especially when we see different variants surfacing month after month. This is in summary, and the paper is available for the participants. We'll move now to the second paper delivered by Mr. Mubarak bin Khamis al-Hamdani. He works at the Shura Council. He's a social researcher at the Omani Consultative Council. He has published many books. He gained an MA in political sociology with a study of identity, and he has published a number of book studies and research papers in a number of Arab and international peer-reviewed journals, most recently Demographic Change and Social Policy in Oman, a reading of population projections in the Oman Vision 2020. 20 minutes is the allotted time, and then we'll throw the floor open to receiving your questions. Thank you.
شكرا جزيلا دكتور يوسف، والشكر موصول للمركز العربي للابحاث ودراسة السياسات على هذه الدعوة الكريمة، وسعيد جدا بالعودة مرة ثانية إلى المنتدى يعني للحديث عن موضوع الجائحة واستجابة سلطنة عمان للجائحة. يعني أنا ربما أنطلق من منطلق اللي تفضل فيه الدكتور يوسف، إنه جائحة كورونا كوفيد 19 لما جاءت إلى سلطنة عمان لم تأتي فقط كجائحة، وإنما جاءت في ظل عوامل وظروف أيضا اقتصادية وسياسية مضطربة، ولذلك أنا سميت هذه الورقة الاستجابة للأزمات في سياق مضطرب. هذه الظروف أو هذه السياقات يعني حدها أول شيء الانتقال السلمي للحكم بعد وفاة السلطان قابوس طيب الله ثراه، ويعني دخول البلاد في تشكل جديد للعمل السياسي والعمل أيضا المؤسسي. الجانب الآخر أيضا كانت هناك أزمة اقتصادية مرتبطة بانهيار أسعار النفط وتأثيراتها على الموازنات العامة والمشروعات الإنمائية أيضا، بالإضافة إلى تباطؤ التحول نحو التنويع الاقتصادي أيضا في السلطنة، وتأثير على قطاعات العمل والإنتاج المختلفة. كان هناك أيضا مشكلة ضعف الإنتاجية العمومية وترهل الجهاز الإداري وإلى آخره من المشكلات اللي كانت تحتاج إلى الإصلاح، وجاءت الجائحة أيضا في هذه الظروف أو في هذه السياقات المضطربة. النقطة الأهم أيضا من ضمن هذا السياق المضطرب أو ضمن هذا السياق أيضا المتحرك أو المتحول، أنه السلطنة كانت في مرحلة تحتاج فيها إلى حشد الإرادة السياسية بالإضافة إلى حشد الإرادة المجتمعية للتحول نحو مشروع وطني جديد وهو رؤية عمان 2040، وبالتالي التحول نحو هذه الرؤى الوطنية أو هذه المقاربات التنموية الجديدة أنا أعتقد أنه يحتاج إلى مجتمعات مستقرة وليس مجتمعات مضطربة. في ظل هذا التشكل يعني تأتي كل دراساتنا أو تأتي كل مقارباتنا للجائحة، وأنا أعتبرها أنها مقاربات لا تزال قيد التشكل وقيد التطوير. ذلك أن الجائحة أولا يعني لم تلفظ أنفاسها بعد من الناحية الصحية، من الناحية الاقتصادية، من الناحية السياسية، وحتى من كافة النواحي التي ضربت فيها المجتمعات الإنسانية.
Even so that's the first dimension. Now the second dimension, it has to do with us as sociologists specifically. I think that what we're talking about is to look further into or reflect on the COVID community, not research it. All the new factors make us develop new means and methodologies to better understand this new post-COVID community. So it is a crisis in the methods of reflecting on sociology and sociology sciences. This COVID pandemic also caused a worldwide confusion for many reasons and for many factors. Again, as sociology researchers, this ambiguity in how we deal with studies and research into the implications, social implications of the pandemic is unprecedented. It also deprived China from the right to free life, and therefore this right was also something that all social structures were deprived of. So those societies fell prisoners of the pandemic and its implications. So if I look into the methodology of this paper, it is not only studying the implications, or rather the effects. We are studying and examining something very important, the Omani community and how it adapted with the pandemic. As Bachelor says it, which is the momentary experience and how the community went through it through their social tools, also through the mechanisms by which they have interacted with the pandemic. I remember a very important saying by Mohsin Bouazizi, a Tunisian sociologist. He says we have to be scared from the ability of the social phenomena to be out of our control and knowledge. So I think the pandemic is the best reflection thereof. Therefore, what should we as sociology researchers and sociologists think about when we examine the pandemic at this specific time? Personally speaking, this reveals the mechanisms of adaptation by the Omani community and the restrictions imposed by health and other authorities in Oman. So we are not focusing on assessing the risk management mechanism or the track for the crisis management. It doesn't also focus on the social and economic impact examination of the pandemic. It focuses on something very important, which is the unconsciousness of the community in dealing with an intangible enemy. This is an unprecedented experience. We deal with climate crisis, natural crisis. Maybe they were tangible, and their predictability and dealing with them were much clearer than the pandemic. But currently, we are dealing with an intangible enemy that imposes a number of mechanisms that call us to understand and look into that and examine that and call it into question. The first question that was raised by this paper: what are the mechanisms adopted by the social system and the phased out dealing with the pandemic? We focus on 7 main dimensions: the unity of the individual, of the family, and of social groups. One of the patterns, which is a social or a psychological shock, is one of the means to deal with the pandemic. The first phase, the beginning of the pandemic, caused a social panic, social fear. A lot of questions were raised by the community. People were wondering if this virus is going to spread out. Is it highly risky? Is it threatening our survival, our demographic continuation? How many people will we lose? Are we able to face the risks? And is the state correctly and rightly assessing the risks. These were all questions raised in the first phases, and then after that, the first cases weren't registered, but with the registration of the first cases in the first month, then we moved to second phase, which is the stigma and the ethical issue by blaming the virus exporting community, which may have led to some hatred and racial discrimination, as well as the delay in adopting the necessary regulations and restrictions, blaming research centers, hospitals, universities, and also the media was blamed for not doing enough awareness raising campaigns. So this was in the beginning of the shock, or at the beginning of the pandemic, and then the third phase was the work mechanisms. This is when the real fighting against the pandemic started. Individuals and institutions alike realized that they have to take action to stop the spread of the virus. They should also put in sectoral and institutional efforts to combat it. Also, the society started showing respect to scientific facts, to scientific think tanks. Then it started thinking about the means to adapt with these restrictions on the daily life. In the fourth phase that we are still living, we're talking about adaptation and adaptive reaction to abide by the restrictions, respect everything that was imposed, trying to create a new typology of daily living and social adaptation with the pandemic. Ulrich, the famous German sociologist, spoke about the risk community, and this is what we are going through. There are two main aspects in this community, as we saw it in Oman with the pandemic. The first aspect he speaks about is that fear is what dictates the feeling of life, and freedom and equality have a very important position in this community. So here we saw the approach of, from a legal perspective, issuing regulations and laws, fines and penalties if they are not respected, which has given the survival issue the priority. The second aspect, Ulrich says that total breakdown may cause the economy of fear. As I had mentioned, the beginning of the pandemic came with a number of economic issues, with the oil price issues, reduction of spending, reducing general budget or public budgets, the issue of unemployment, people being laid off, and the suffering of small and medium enterprises and projects. Now, in terms of the methodological aspect of the pandemic, there was an important question that I thought should be raised. Where did the Omani community live through an information exhaustion phase due to the abundance of information, correct or incorrect? So I assessed that through different phases. First one, Feb 2020, then end of 2020, then March 2021. With the same tool, with the same referendum on the same social group, to see how they were changing with the in terms of dealing with the source of information. The large majority of Omanis, 25%, confirmed that they were receiving the news and information by following the experts, the specialists, and the official authority accounts. So this goes to show that the official news media are the ones running, they were able to control something very important, which means, which was that they didn't push the community through an information exhaustion, and they didn't distract the sources of information. That's the first important aspect. Second, this other group, 21%, they were receiving the news and the information from the most shared content and posts on social media. The third group was receiving the information through social media networks. We're talking about 16% of those. So the largest part of Omanis were relying on the official authorities and official sources of information during the different phases of the pandemic. In Feb 2020, in December 2020, and in March 2021. So the results were almost similar. Another question that this paper relies on and focuses on, there was the so-called information virus. This was an idea that was talked about by the WHO at the beginning of the pandemic, and they were warning against it because it would push the communities to a state of information virus, which means the inability to control the information and confirm scientific facts, and this would be controlling the public space, which is not beneficial for the community. And here I use another tool, a multi-tool or multi-approach methodology was the one I used. And this other tool was applied to around 253 individuals in Oman, which is the closed questionnaire tool, to assess whether there was a case of information virus in parallel or caused by the pandemic. Amongst the questions that were addressed, do you think that it was important to restrict some personal accounts that were talking about the pandemic on the social media? The biggest number of Omanis approved restricting those accounts. So we're talking 57% of Omanis. Another question, were the official Omani information sources in harmony and in coordination with social media outlets or with traditional media outlets? The Omanis agreed that the message was balanced and that the state had truly established a good balance between the traditional media outlets and the social media outlets. They also agree with the fact that the state was able to control the flow of information on the pandemic in the social media outlets, and they were able to foil or debunk false information, misleading information, as well as rumors. In general, there were no differences, no discrepancies in terms of the geographical dispersion. So the answers were similar throughout the Sultanate. Also, the educational attainment level was not an affecting factor in this questionnaire. And among the questions, are the info and data provided by public sector authorities clear? Not everybody agreed on the same answer here. Another element for this question is that we directly asked the targets if the sources of information were all consolidated. Most of them were unable to focus on one specific source of information and data. So there is a medium state of information virus that was caused by the pandemic in Oman. But later on, there were some measures and as well as legal approaches taken to control the situation and to help the community achieve an information stability as well as control the sources of pandemic-related knowledge. Another question, is there a social stigma that emerged in the community due to the pandemic? It is one of the main issues related to crisis and specifically pandemic-related sociology, which is stigmatizing a certain number of people, certain number of groups during a certain crisis and the pandemic. So there were three main patterns that emerged, but they weren't very widespread. And then they stopped at a certain phase of the pandemic. The first pattern, the first stigma, if we may say so, was vis-a-vis the patients who got the COVID. So they were looked down on. For the ones who got the virus at the very beginning of the pandemic, they were perceived to be different. They were blamed even. That was in the first phase. The second phase is what Karl Meinheim calls the closed pattern problematic, differentiating between the residents and the nationals. However, the pandemic has proven that we don't really understand these communities from the inside. We don't understand their cultural factors, their leaders, how to reach them, to raise their awareness. So it was the same as the closed patterns that we saw. We're talking about the residents' community. What compounded this problem is that during the first 3 months of the pandemic, the majority of the patients, the COVID patients, and more than 60% were laborers. So the community was very fearful vis-a-vis these laborers. Now, the third stigma that was very short-lived, and this was the very last social stigma during the pandemic, was related to the ones violating the social distancing and all the restrictions. So the community was stigmatizing those who violated the restrictions and considered them to be a big risk to the community. Their behavior is threatening the survival of the community. Such a stigma can be considered as supportive of the policies and the responsiveness, the public authority responsiveness to the pandemic, because it helps the authority put an end to this kind of behavior that violates the restrictions. This paper also examined the issue of rumors, to which extent rumors were widespread about the pandemic. What's good about the Omani community was that there was an effort to debunk those rumors. From the beginning of the pandemic, around the 16th of March, the rumors that were debunked on a daily basis was around 7 rumors as an average. They were officially debunked, they were officially clarified by the authorities. But then after that, this curve was flattened by the beginning of May 2020. And this has helped with a number of approaches. First, there was a legal deterrence for those elements spreading rumors. A very important element was the emergence of the local media in debunking those rumors and those myths. There was also a very important issue with the weekly conference by the authorities to clarify the situation. So the public would revert to that conference, would wait for the conference, and therefore debunk the rumors and the myth during the conference. Maybe we are running short on time, but the paper also viewed the nature of those rumors, their symbolic implication, their symbolic effect. And the paper tried to elaborate on the structure of those rumors. Eventually, we can conclude by focusing on 4 main points in this paper. The COVID pandemic was too big to be immediately understood and well processed by the community, and the community had to come up with new adaptive mechanisms with this pandemic, just like other communities. The scientific people were relying on science experts and specialists to understand the pandemic, and at a certain phase they were trying to mobilize critical thinking regarding the rumors and the myth. Also, the public deterrence theory proved to be the main gateway into the Omani community's approach of the pandemic. The better equipped they are with critical thinking, the better they are willing to abide by the restrictions. Another point, the Omanis in general, through most of the polls that we conducted, don't show a tendency to operate radical changes in their conduct and behavior during the pandemic. They always reverted to their traditions, to their customs, to their traditional perceptions, and they didn't think, the Omanis didn't think that the pandemic would really affect their culture and their behavior in Oman. And that's my conclusion, and thank you for your kind listening. Thank you, Mubarak. So the paper tried to raise a number of questions, most importantly, the adaptability and the responsiveness of the community and the different community elements in general. The paper also tried to identify to which extent the communication and the media outlets were able to convey the message in a timely manner and to debunk the myth and the rumors. The paper also raised a number of warnings on the importance of preparing for the future and any future crises or pandemics. I hope and I think that this is going to be a very fruitful paper that you can rely on. We will now give a chance for the Q&A.
Thank you, Dr. Yousuf, and thank you for the two panelists for the rich interventions. I'd like to ask about the peculiarities of the Oman story. Following this intervention and yesterday's interventions, there are commonalities in the decisions taken in the Gulf countries and internationally. Perhaps there is a universal model to deal with the crisis internationally and locally. And thus, I'd like to ask you about the different measures that you've taken in Oman. Thank you. Abdullah Al-Harmi from Juan bin Jasim's Academy. Thank you, gentlemen, for your elaborate papers. I do agree with you. Indeed, the pandemic has impacted the whole world. Perhaps we need to revisit some of the measures taken and we need to perhaps contemplate the issue further. My question is addressed to the researcher Mubarak. Undoubtedly, the pandemic has led to certain societal conduct. I think it has constituted a good opportunity. We as Arabs, especially in the Gulf, we follow certain erroneous practices. Perhaps the pandemic is an opportunity to learn lessons and curb such bad habits. in our community. It is high time for our communities to learn from our mistakes in order to perhaps plug these gaps and avoid such shortcomings. Thank you. Ahoud Leblushi, a very good day to you. Thank you, Dr. Ashraf. Thank you, Mr. Mubarak, and hopefully you'll become a doctor soon. Thank you for your papers. Mr. Mubarak, you've talked about information fatigue. What about information starvation? I think we are all looking for further information to reassure ourselves. And you've concluded your remarks. You've said that the sample in place did not envision any changes in the conduct. Is this true? The pandemic has been with us for 2 years, and we do not know when it will be eradicated. So do you think that the conduct will still be the same? Don't you think that this has changed the conduct of certain individuals in our society? Thank you. A very good day to you, Dr. Naif al-Shammari from the Kuwait University. I'd like to touch upon the first question displayed by you, Doctor. You've talked about the performance of Oman. Oman has 2.8% as far as the growth is concerned. Perhaps this growth is better than other countries. Is this due to the measures that Oman has taken, or is it to do with the economic model? And if so, what has been peculiar or distinguished in the Oman's story? Another question, what about the individual's income? Do you think that this has played a role in staving off the pandemic? You are focused on the other factors. What about the income? Yes, questions are important. The first question asks about the differences of the Omani measures in addressing this pandemic. The lady has talked about the lack of information and being reassured and being certain. There's also the talk about the stagnation of the economy of Oman to the tune of 2.8. And this was the least kind of percentage in the Gulf. Thank you. The Omani experience in addressing the pandemic has related to the swiftness of the measures taken by the government of Oman. Oman has acted very swiftly, and it has taken stringent measures to face the pandemic. Preventive measures have taken place. A higher committee headed by the Minister of Interior was established since the first patient has been discovered, and this is a good reaction on the part of the Sultanate. The Sultanate also, within the first week of the pandemic, has issued a package of measures on the part of the central bank 8 billion Omani riyals were injected in the economy to curb the impact of the pandemic. Before even knowing the size of the pandemic, there was a clear vision, clear decisions on the part of the leaders, and this package has been issued, as I said, in the first week on the part of the central bank, 8 billion Omani riyals, that equals 20 million American dollars. So this has been conclusive in helping the government to start the procedures very quickly. So the swiftness of the reaction has played a major role even before the pandemic has exploded. There's also another factor. The Sultanate has also acted swiftly in dealing with the plummeting prices of oil in March 2020. They have redirected investments in the non-oil sectors, especially the industrial sector, the logistic sector, and the Sultanate depended further on its ports to export the goods and import commodities. More than 80% of the imports came through the Emirates in the past, but now it is half of that percentage. So the import and export movement took place through the Omani ports, and this has constituted a good factor in the recovery process. The financial packages as well and the incentives played a direct role in the recovery, and this was not confined to the government's measures, but efforts were concerted between the government and the private sector and the civil society to address the pandemic. And I was one of those who worked in this domain. The private sector indeed has activated the corporate social responsibility. The Chamber of Commerce had a fund that has 1 million riyals to help the SMEs. This took place in February, in the beginnings of the pandemic. This has helped a number of companies that have been impacted by the pandemic since the start. In addition to raising awareness vis-à-vis the facilitation tools utilized by the major companies, the medium-sized companies and the SMEs. The dynamism of the government has been splendid, and the swiftness in taking decisions, being stringent in the measures and the application. There was also a balance between the partial lockdown and the complete lockdown.
الانطلاق الجزئي والكلي، فده ساعد كتير ان يبقى في نوع من
This also has helped
التعامل
to
مع
deal with the
فده من
pandemic.
ناحية التوازن أهم ما
So these were the most important factors
طبعا
that were
السلطنة
peculiar
عملت في فترة
to the
من
Sultanate,
الفترات كانت
and I think
النموذج
that
بتاعها
Oman
كان بيحتذى به أو بيتبع من بعض
has
الدول
constituted
الأخرى في التعامل مع الجائحة، فهي كانت سباقة
a model
بشكل كبير في
in this regard. Thank you. I'll start to answer Dr. Naif's question.
ربما هذا على مستوى الافراد يعني ربما يكون من قصور الورقه انها لم تاخذ
The paper has not covered the income factor,
واحد من الادوات اللي طبقتها
but one of the tools that I have utilized in my paper related to interviews that have been conducted with 40 families, 20 headed by women and 20 headed by men. So the question was, is there a difference between the two? And we've found out that as regards the families headed by men, the three main concerns were as follows: the electronic games and the media preoccupation, the virus itself, and the income in the third rank. As far as the families headed by women, the first concern was to do with having an elderly person being infected. Second, the income. Third, the domestic violence related issues. So, and we've rephrased the question and we said these are the concerns. How did you cope with them? Those headed by men, the answers were as follows: to provide the basic needs and not to exaggerate the consumption, to have a day of dialogue between the members of the families, and one day to care for the elderly. The families headed by women rather, the coping mechanisms were as follows: to teach the members of the families, especially online, to have a day of activities to acquire more skills in addition to entertainment, and to have one day for the elderly to liaise with the other members of the families. So, in light of the discrepancies in the income, I think that these concerns and coping mechanisms explain the situation of these families and provide us with an indicator to the nature of the crisis. As far as the fatigue and the starvation question, I think in Oman we used to starve and then have a heavy meal at the end of the day. In some of in some other countries, they used to have conferences on a daily basis, but we had organized conferences intermittently and focused on the information available. So I reiterate the fact that the conference that we used to hold has provided a platform to disseminate information. As regards the sample, I said that those who have been interviewed said that the conduct might still be the same. The sample incorporated 535 persons, and they've said that the digital life will be prosperous, i.e. Communicating through the internet and so on and so forth will still be with us, and the pandemic will encourage it. One other important point related to seeking an alternative source of income. Some individuals worked in SMEs and they become endangered with layoffs and dismissal and so on and so forth. So they said that this might lead to a change and the source of income will be different. As regards consumerism, we asked the interviewees about the change in consumerism, and they said that it will still be the same. There's also the social distancing and other issues. They said that the conduct will change definitely once the pandemic is eradicated. Then we'll come back to our families, and the social distancing shall disappear. So I think that the main cultural units will still be the same even after the pandemic. I would like to answer Dr. Naif's question. I think the Sultanate of Oman is cognizant to the fact that the oil revenues are of a lesser importance when it comes to the sustainable development. The diversification, economic diversification path has become a priority in the economic policies of the Sultanate, and hence during the period of the plummeting prices of the oil, we haven't seen a crash or a decline, a huge decline in the activities of the economy of the Sultanate. And the reason being that some other sectors have flourished, and there was a focus on the industrial sector to lead the way and to fill in the vacuum that the oil sector has created. As I said, the logistics related sector has flourished, and huge investments were poured into this sector. So the Sultanate is interested in investing in the infrastructure, and the measures do focus on developing the activities rather than the structures, and this provides a room to the government to distribute the financial resources more smoothly in comparison with other countries. There's also another point pertinent to the size of the structural change in the economy by and large, namely the institutions and the ministries. Indeed, entrepreneurship has been encouraged, business by and large has been encouraged, and this has been extremely positive. The private sector has been taken care of by the government. Huge institutions or the major corporates in the Sultanate have become patrons to the SMEs. So there is a coordination that is going on, or perhaps complementarity in the efforts made, and this has surfaced during the last 2 years, especially following the outbreak of the virus. The social corporate responsibility and the participation of the major companies, Asyad, Imran, and other major companies played a major role in protecting the SMEs and the small-sized and the medium-sized companies, protecting them from decline.
وده إلى حد ما يعني يعني حد من التأثير السلبي.
All this has curbed the negative implications of the pandemic, but still we are not certain that this will constitute a pattern in the economy, but still the outcomes are satisfactory, especially when we have noticed that there are recovery features in the economy of Oman during the last or the latest months. As I said, the credit rating is stable and the deficit is shrinking in Q4 of this year, and the policy of openness to the other Gulf countries is afoot, and the partnership with the Kingdom of Saudi Arabia is going on, and the possibility of the Saudi investment injections in the Sultanate's economy is a good sign, because this will help to recover. As far as FDIs are concerned, there are FDIs from the Asian markets to the tune of 6 billion Omani riyals, and this also has mitigated the burden shouldered by the government and created a number of jobs. So all these measures took place during the pandemic, and they indeed have helped in the process of recovery.
ولكن طبعا مع ظهور المتحور الجديد بالخطورة بتاعته يعني اللي احنا سمعناها,
especially when the latest variant has surfaced and is spreading in different countries. But still, the rudimentary kind of indicators say that during the upcoming year, 2022, we shall be witnessing a recovery, and the growth will be positive, and it might reach 2.5% or 3% in Oman. But still, conjecture is very difficult in this context. Thank you.
معنا 5 دقائق قبل الاستراحة لو في حد عنده تساؤل.
Any further questions?
في نهاية هذه الجلسة نتقدم.
At the end of this session, we would like to thank the two panelists, Dr. Ashraf and Brother Mubarak. Everybody understands the importance of the measures taken to stave off the pandemic. I would like to thank you, and we hope that the papers constituted food for thought. Thank you, and have a good morning.